Good morning and welcome to today's panel discussion on the treatment and prevention of substance use disorder in St. Clair County. Today is the concluding presentation of our 2023 Recovery Summit. It's been a great run this year again. And this Recovery Summit has been made possible through collaborative effort with St. Clair County Health Department, St. Clair County Community Mental Health, and a lot of our other provider organizations. And we have been really fortunate to host 22 sessions so far this month. And I was just told this morning that we've had really great attendance at all of them from all over the state of Michigan, averaging over 150 per session. So that's been great. The word's getting out there that we're doing it. And I think the free CEUs help a lot. So that's been great. So my name is Deb Johnson. I'm the CEO at St. Clair County Community Mental Health. And I am very honored to welcome our panelists today for this discussion. We have Matt King, Sheriff of St. Clair County, Jim Johnson, the CEO of Region 10, Ken Huvelman, the Clinical Coordinator of Port Huron Odyssey House, and Liz King, the Health Officer at the St. Clair County Health Department. So welcome all of you. And to begin with, we're going to pose several questions to the panelists, or I will pose several questions. And then at the end, if we have extra time, we will respond to any questions from attendees. You can submit questions anytime throughout the presentation using the chat feature. And if we have time, we'll get to them. And if we don't, we'll answer them in a different format and get that out to you. So let's get started. So the first question is, what are the challenges and emerging trends in our community concerning substance use, especially among the youth in our community? So let's start with Ken Huvelman.
So what we see from our perspective in the clinical sense is really a rise in methamphetamine. Methamphetamine still seems to be an emerging and increasing trend. We also are continuing to see fentanyl work its way into a lot of other substances, not just our opioids and others. Anecdotally, through some of our work through our overdose response team, we are hearing folks telling us that they believe xylazine, which is a tranquilizer, is also starting to become present in our community. So we've seen that use of stimulants going up. Also with the youth side, it does seem to be the vaping. The cigarette smoking seems to be a thing of the past. It is now vaping in the boys' room instead of smoking. So seeing the vaping, which is that starting point for a lot of kids to begin using something.
Liz.
Sure. I think I would tag on to exactly what Ken had just said. So what we see in our lane at the health department is a lot with our behavioral risk factor surveys that we do within the schools. And yeah, 20 to 25% of our youth report that they're vaping, which is a huge number. The other concerning, I don't know that this is a trend, but concerning is that 1 in 3 or 33% report that they actually are living with someone with a substance use disorder or who has a problem with alcohol. And we know that those adult behaviors impact our youth, how they cope, right? Their mental health, their emotional health, all of that. And I think that kind of trends into their choices and behaviors and the vaping and alcohol use that's going on. Also, I don't know that it's a trend either, but concerning is the use of, in our overdose deaths, the use of poly substances, right? 50% of our overdose deaths were using multiple substances. And like Ken had mentioned, I believe it is 63% were using fentanyl. Wow. And one of our challenges, I just want to mention, is staying relevant, right? With the youth, to remain relevant is always difficult and keep up with trends. That's a big challenge for us with youth.
Yeah, definitely. Jim, you have anything to add?
So in terms of challenges, one of the biggest challenges we face as a funder is actually provider network capacity and having that capacity for more intensive services in county. So we fund a full continuum of services, but there's not a residential provider that sits in St. Clair County. There's not an opioid treatment provider. So if someone needs methadone, they're not getting that in county. And it's hard to get detox services in county. So having ready access to those very necessary, critically necessary services at times it has been a challenge, as well as having transportation to get folks to out-county resources when necessary. In terms of trends for us, in terms of people who are accessing treatment through the public system, alcohol remains the biggest drug of choice. About 42% of our admissions over the past year were for alcohol, and that has been rising, steadily rising, not by a lot every year, but rising. We have seen a decrease in admissions for heroin, and it's actually, we've seen a decrease every year since 2018. So about 20% of our admissions last year were related to heroin. And of course, we've seen an increase in admissions for methadone or for methamphetamine. And that has increased every year since 2018 to kind of tack onto it that, Ken is seeing, and I'm sure what Matt has seen for longer than that. It's increased every year since 2018, and it's about 15% of our admissions are for methamphetamine use. We've also seen an increase in cocaine-related admissions across the region, but most of that is related to Genesee County. When Genesee County has a spike in admissions, it drives our regional numbers. So the cocaine admissions in St. Clair County aren't necessarily increasing, but across the region they are.
You're all sharing a lot of really alarming statistics and things that we need to continually keep our eye on. Matt, how about from your perspective?
Yeah, I think a lot of what I'll say is I'll echo what's already been said. Methamphetamine use is up in our population. And the scary thing is we've seen and heard and through interviews and information gathering that juveniles, young people are dabbling in the methamphetamine. That probably goes along with what Liz King said when she talked about people living in homes of addicted. We know young people are way more apt to try drugs if they're in a household with drugs and alcohol use. And again, the presence of fentanyl found in all drugs. People are thinking they're getting meth or maybe it's cocaine or whatever they may be getting, and fentanyl mixed in on purpose or accidentally, because these cross-contamination, obviously these drugs aren't made in a professional lab. Pressed pills are also a problem too. People are overdosing, thinking they're getting maybe a prescription pill. Again, there's still the myth out there that they're safe to use because it comes from a pharmacist, when in fact is not actually from a pharmacist. We have pressed pills, and a huge percentage of pressed pills have fentanyl in them. And then now we're talking about deaths. And finally, I'll talk about the lack of beds for our young people for rehabilitation centers and mental health. We know so often that people who are suffering from mental health problems self-medicate with substances. And when there's no beds for kids to go or young people to go to, they end up staying in an environment in which has fostered an opportunity for them to use drugs to begin with, and the cycle continues. So those are the things that are really challenging right now with youth as far as law enforcement.
Yeah, and I would just reiterate what you said about the shortage of residential capacity for kids on the mental health side, and a lot of those kids are also using substances. So it's a huge challenge, and I know locally we continue to address that, and hopefully we'll come up with a solution, and hopefully we'll get some help from some changes in the current legislation. So let's move on to our next question. What impact has COVID-19 had on substance use disorder and harm reduction efforts in St. Clair County? And I will start with Liz on this one.
Thank you. That's a big question, right?
It's a big question.
We probably could have
you were in the thick of things during COVID, so I figured you had a bird's
Right.
eye view of all this.
Well, right. We could all talk the whole hour probably about this question and the impacts of the pandemic on all of our departments and what that means. And yes, we were in the thick of everything. And I just remember board meetings with parents talking about how touching it was to us when you hear about their kids and their students and how they're suffering during this pandemic, and that we had to put these mitigation measures forward and what it's doing to the kids at the time, but not just youth, but adults. So the impact of the pandemic was very far-reaching, I think, on us emotionally, the stress of everything, mentally, which again rolls into behaviors and how you cope and your level of resiliency. Now we can actually look back on some of that data and support those stories as well. So you get both sides. You get the numbers and you get the stories, so we can see the impacts. And I think most alarming that we've seen here is that, not most alarming, everything is alarming, but that alcohol sales, right, in 2020 were 2.9% higher across the nation. And that trickles into St. Clair County. That was the biggest increase in over 50 years. So everyone was drinking a lot more across the board. Then we do our big community health needs assessment in 2021, and we see the report of binge drinking in our adult population go up as well. So that was up to about 24% of respondents indicated that they were binge drinking. Highest prevalence were in the 18 to 34-year-old male range. Again, vaping, we have adults that vape as well. That's not just a youth behavior. That is also in our adults, and we doubled that number as well. About 4% of adults were vaping in 2016. Now you're up to 8% of adults report that they're vaping as well. I think also concerning that came out of that community health needs assessment were some mental health, what we refer to as our ACEs in there, that again, 1 in 3 people are living with someone who has an issue with substance. 1 in 4 reported living with someone who is depressed, mentally ill, or suicidal, 25% of people. Then 16% reported living with someone who was abusing drugs or illegal drugs or prescription drugs. But one of the good things, I don't like to always focus on the bad things, about COVID. We like to address those things. But one of the good things that actually came out, and I'm sure Ken will speak about this as well, because he was kind of front and center on pushing naloxone, right? So we have increased the amount of naloxone and kind of destigmatized carrying naloxone, that it's now just part of first aid. So between 2020 and 2022, in 2020, we put out 420 kits in the community, all of us working together. In 2022, we had over 2,800 kits put out. And again, I like to correlate this together. I think scientifically and data-wise, my data person would tell me I'm not allowed to do that just yet. But we have seen our overdose deaths go down, right? 2021 saw a very high amount of overdose deaths as well. Can we say that was pandemic related? Maybe. Coping related, right? So we had 65 overdose deaths in 2021. That was a 10% increase over 2020, and that was larger than the state of Michigan. The state of Michigan only saw an 8% increase. We went up 10%. But in 2022, we're all working hard to get that naloxone out, raise awareness. We dropped that back down to 38 deaths and a 42% decrease. So I'm not sure, that's not my lane to say if there's less drugs in the community. I'm not thinking that's what's going on. I think there's more naloxone out there and people are aware of how to use it.
Good. I was just going to say, I assume probably the majority of our attendees know what naloxone is, but do you just want to really quickly say, in case somebody on does not know what it is?
Sure. Right. Well, it's a life-saving drug that you inject, that's available all over the place now, thanks to Ken and community groups, that is free. There's no prescription needed. You can actually watch a quick video on how to administer it, and it actually reverses the overdose if there's an opioid on board.
Perfect. Thanks. Ken, you want to go next since she's been referencing you?
Sure. And with that, so there's an injectable, and then the ones that we've really placed out is just a nasal spray.
Yeah.
And it's so simple to use is what's made this really great. And it was when the health department became a little bit overwhelmed with what they were doing. COVID kind of hit them very hard. So as a community provider, we kind of looked and said, wait a minute, let's just kind of take that spot up. So yeah, we were able to kind of start to push naloxone out. You should start seeing some of those kits and some boxes to distribute across the community. And that showed a shift as well. We had a vending machine to place during 2020, and I was unable to find a secure location for that at that time. Since then, it shows that our perception, our stigma has shifted because we've placed 20 of those distribution boxes throughout our entire county. Every library branch, the bus transit center, CMH has one at each of their main locations. So we've seen a stigma shift, something change to help it start clicking. So that was huge. Some of the bad things that we saw that came out of the COVID was just the increased isolation. For people in long-term recovery, very often they use a recovery support program. And when the churches closed, when the buildings closed, those meetings closed as well. But as many who are people in long-term recovery, we were creative in our ways to obtain drugs. We became creative in ways to maintain our recovery. Zoom, meetings like this, the webinar world just exploded. So out of COVID, we saw really just innovative service delivery. We use telehealth. It is just a normal thing to meet with a clinician or a counselor or a recovery coach through video. So really seeing this take off and become a viable service was super helpful. And we've seen how that helped eliminate those barriers of transportation and just increase the ability to engage, some of our rural communities and those folks that couldn't get. So like Liz said, we had good things that came out of it. And then of course there were the negatives where boredom, lack of activities just increased use. So that was really some of the main things we saw related to COVID for substance use.
I also agree with you in terms of one of the good things of reducing stigma, because I do think a lot more people started to be comfortable talking about having anxiety or depression, feeling disconnected and needing help. And I think that's made it better for a lot of people. And I also think you're right about being creative with Zoom. And I think that's been great for a lot of people who have difficulty getting out of the house for whether it's transportation or other reasons. But even something like this, this is our first recovery summit, was supposed to be in person and it went online because of COVID. And now it turned out we're still doing it because now we have people from all over the state of Michigan participating in the different sessions. And it's been great. It's an easy way for people to learn the things we want them to know about and to and get free CEUs. So continue on with the answer to that question. Jim, do you want to go next?
Sure. One of the biggest impacts we saw from COVID was on our provider network and the inability to keep programs staffed. And it was especially those programs where you required congregate care, when you had a residential program or a detox program where you really obviously need people in the building. During the height of the pandemic, it became very difficult to get program staffed and to maintain capacity, because as people who were providing treatment or receiving treatment became positive for COVID, it changed the whole environment and it really reduced the amount of space you had, the amount of folks you had who could intervene. So the system, frankly, still has not fully recovered from that. It is still, people got used to working remotely and decided they didn't want to maybe come into buildings to work. And so our residential providers and our outpatient providers as well still have significant difficulties with staffing, and we're hoping that we make headway into that. But it hits the more intensive services more harshly than it does our outpatient services, but it hits them all. And I would agree on the probably the biggest positive impact from the pandemic was getting the federal permissions to expand the use of telehealth throughout our system. And then as we kind of piloted that and saw how well it worked for a large portion of the population. It's not for everybody, but when we saw how effective we could be implementing telehealth measures, we were able to work with the state and convince them that they needed to kind of keep some of these permissions as routine health interventions. And so we have seen changes in state policy that allow us to continue to fund telehealth beyond the pandemic. So that's probably the biggest, from our perspective, positive to come out of the pandemic.
All right, thanks. And Matt, how about you?
Well, again, I'll echo a lot of what everybody said. We had a disruption of services for people, maybe people who suffer from addiction or mental health. And obviously those people were in our community, and especially in the heat of it all, the only people that were going to other people's doors were law enforcement, other first responders. So we really took on a burden of handling, getting services if we could, for individuals who were away from their mental health services or away from their, NA or AA groups. And then, of course, like Ken said, we got creative with online services. But we did see a big problem with that too, because people didn't necessarily feel like they're getting the same level of service. And of course, people suffering from addiction, accountability is big in recovery in that part of the world. So being able to get online and perhaps not be caught cheating, if you will, when going through recovery, that interruption of services really affected a lot of people in the addicted world. So our group of people that we were interacting with who were using substances did grow during that time. And then, of course, increased isolation brought on another level of mental health problems. People who otherwise didn't necessarily suffer from depression or anxiety really were affected negatively. And then getting back out into the world, it's been difficult for a lot of people. And we run into a lot of people who now have anxiety that didn't before in public places. And we're seeing people work through that because we've got some time lapse. So that's a positive direction we're seeing. And the other thing that really wasn't brought up is the loss of trust in the government. Whether it was because of COVID or not, it certainly grew during the time in COVID. And you can blame the various networks who take a side and stick with that side no matter what's really happening. But the news medias have been really the only information people got for a period of time. And they sat in front of the TV because you couldn't go anywhere or talk to anybody. And they were fed either far right or far left information. And so many believed it, no matter whichever side they decided they were going to believe in. There's a big lack of trust in government right now. So that's something we see in law enforcement. Liz, I see you're shaking your head. I'm kind of surprised you didn't bring that up with vaccination and such. So it is a big thing that we see. Obviously, we don't deal with vaccinations or the medical part of it. We deal with people who are super paranoid with interactions with any government entity. Luckily, generally, the sheriff's office is a trusted office because I'm elected, but it's a big challenge in law enforcement. Very well supported in St. Clair County as far as law enforcement, but that's something that I guess I wasn't surprised to see, but I'm surprised it hung around so long after COVID's kind of in the rearview mirror.
Yeah, a lot of good points. So the next thing I know you're not a direct substance use provider organization. One of you funds, Matt, you contract, but can you just talk just briefly about services that are either offered or contracted for that we know that we have in this community? And then I can talk briefly about community mental health services. Go ahead, Liz.
Oh, sure. I'm sorry, I thought you were going to Matt. You caught me off guard.
That's okay. I saw your thing light up, and so I thought.
I'm just moving here.
Okay.
No problem.
You can go to Matt if you want.
Yeah, no. Our services here. So we provide a whole lot of services in here. I think first and foremost, what's important to remember is that someone who uses substances is just embedded in our community. So every service here helps someone, I'm sure, who's coming in with a substance use disorder at times. So we definitely train our staff to be unbiased towards those individuals and supportive. And when we do referrals, those kind of things. So we do outreach. We have a peer recovery coach on site here part-time, which has been a great addition. We do the data collection and analysis on a lot of these indicators for the county. We convene the community, right, with our community health improvement plan to work on these very big picture needs. And then most importantly for our direct services is what you see me in this room. If anybody was wondering, this is our what we call our syringe service program or our exchange, our harm reduction program. This is the room here at the health department. It is a converted clinical room where you receive your services. And behind me, this is how we store all these things are in these Craftsman toolkit. So everything in here is divided up that someone would need when you when you indicate that you're looking for to be part of our exchange program and you're looking for clean works, right? So our harm reduction program, which again, I always take the time to mention what harm reduction is. And it's a set of public health strategies that are there to reduce the harm caused by drug use or substance use. And that's our role. That's our lane, right? First and foremost would be overdose. That is the most serious harm that can be caused. So we have our naloxone program I was talking about. There's also referrals into peer recovery. Every time you're in, we're talking about getting into recovery. There's also fentanyl test strips available here. Then we look towards preventing a lifelong virus like hepatitis C or HIV. So we offer testing for those who come in. And part of that, again, is our syringes, clean works, those kind of things that are going to keep any blood products out of the process of injecting drugs. We offer Band-Aids, first aid, Band-Aids, triple antibiotic cream, those things prevent abscesses or soft tissue infections that you get from progressing into more serious cellulitis and those kind of things. So we kind of talk about that a little bit. And then just personal hygiene. We kind of expanded that's a bit, when someone is in the midst of addiction, they're not paying attention a lot to personal hygiene. So there's toothpaste, toothbrushes, shaving cream, razors, soap, feminine hygiene products. All of that is available here in this mix as well. So we do that. And one of the trends we've seen, I think was important for me to talk about here, is through COVID. This was our intent, right? When this program started back in 2019 or 2018, around that time, it's hard for someone to walk through our building and identify that they need this service. And COVID forced us to close our doors. We still wanted to be able to provide this service to our community. So we went to these grab bags. Our staff had these great ideas. And these are just blank bags with supplies in them, like a small kit with your sharps container. They have the syringes. We just picked the most common syringes that people use and put a 10-pack in here. And that's actually what we're giving out in the community. And we've kind of seen a shift that this is much more preferred by our community to walk in, go to front reception, get a bag and leave. Or be out at the community. We're out at Odyssey House, we're at Harbor Impact Ministries, we're at the Soup Kitchen, mobily. And this is what we're bringing out mobily with vaccines, with testing. And lastly, I just want to mention a recent grant we received was to purchase lock boxes. So these are available free for people who indicate the need to lock up their medications here. So you just call the health department. And we can connect you. We have 2 different sizes, and we're going to see how that goes and hopefully prevent some accidental poisonings.
I think that's great. And I think it is important to continually talk about the harm reduction strategies. And I know that there are some people that think that we shouldn't be doing some of the things that we're doing in terms of harm reduction. But, I mean, we've talked about this, like if it was your son, your daughter, your spouse, or whoever, wouldn't you want to at least keep them safe until you can get them into recovery? So, or
right.
until they decide to be in recovery. So I think that's great.
And it's always a touch point. Remember, there's always a touch point and great information on treatment and recovery. Lots of it we give every time they come in here. So, yeah, you're right. There is some general public who, not just general, there are just people in our community who don't support the program. And I think a lot of times it's a lack of understanding, misunderstanding, maybe a concern about local funds. There are no local funds put into this program. This is 100% grant funded. Yes, I know those are tax dollars as well, whether they come federally, statewide, or locally. But my counterpoint to that always is when someone has HIV or hepatitis C, if you saw the cost for a lifelong viral infection to be treated, and you would think that this program was definitely the better fiscally to be ran.
Definitely. I did see, I know there's a lot of stuff going on in the chat and I haven't kept up with it, but I saw somebody just pop in that said, what health department can you get the lock boxes at? And that's at the St. Clair County Health
Yeah.
Department.
And
'Cause
we're
I know
not the
that
only
people-
one. We're not the
There might-
only one. This program, a lot of
health
local
departments.
governments received the dollars, and this is what they're choosing to do. So start with your local for sure.
Okay, great. Ken, you want to go next?
Sure. And I just kind of wanted to touch on that harm reduction part. We mentioned vaping, which was identified. Many people switched from cigarettes to vaping because it felt safer. And it's that term of safer use of nicotine. That was a harm reduction move by many adults that gave up the cigarettes for that vape. So it's those ones, even in our world as well, we see the people who are struggling with their drinking. So they say, if I just stop drinking liquor and switch to beer, I'll have a problem. It's the weird justifications to change and just become safer, reduce the risk that it has on me physically and mentally. So we see a lot more harm reduction that goes on than I think people actually realize. What we have for service in our community, and Jim kind of mentioned this, is we do have a large number of outpatient providers. There is a large amount of outpatient counseling services available in our community through CMHs, Odyssey Houses. You have a Sacred Heart, professional counseling, Catholic Charities. So there's a large number of outpatient providers that provide that standard clinical treatment with a therapist, group therapy. And then we have a large amount of peer recovery coaching, which is a lived experience-based profession. It is for those who have gone through recovery or peer support specialists who have dealt with and managed their own mental health concerns. So it is a peer level navigator to help them guide them through the services and help them maintain that long-term change. Also in our community, we have a couple recovery housing providers. Odyssey House provides recovery housing for women. Then we have Crossroads Recovery Community, who provides men's recovery housing as well. We see the naloxone education distribution that's taken on again by the health department and then community-based organizations like ourselves, PW Rock, and others. We have a program here at Odyssey House known as SPORT. I presented on that here for the Recovery Summit a couple of weeks ago. That is a mobile overdose response team. That's another thing that kind of came out of COVID. We were at the hospitals. The hospital said, maybe you shouldn't come here. That was summer of 2020. And we said, yeah, let's stay at home. So we mobilized it. We took that and created a partnership with multiple law enforcement agencies, with Port Huron, with Yale, with St. Clair, and then working with Marysville, hopefully soon, to respond post-overdose. So if there's an overdose in one of those communities, we go out with a peer recovery coach, a clinician from CMH's mobile crisis unit, and then a semi-uniformed police officer. And just engage conversation. So going to the clients or the potential clients, the individuals who need that assistance at their homes. Additionally here, like Jim said, we don't have some of those higher levels of care, residential detox, and opioid treatment program. Those we don't have. We have access to them. There are community organizations that help with transportation, but even then it becomes limited with the number of people that need transport to those. We have a large recovery community for support groups that are hosted by a lot of our local churches. Our recovery community organization with PW Rock hosts a large number of meetings. We have a dry dock recovery room, which is downtown, conveniently located right next to the brass rail. So some people stumble into the wrong door and find themselves in a 12-step group, which is just fine. So we have a lot of those recovery programs in those low intensity cares. But like Jim said, we do lack that next entry point for those people that are, a more severe concern or issue.
So Jim, do you want to talk about what we do with the people, or from your perspective, but also with people who are more severe? I know that you guys help facilitate referrals.
Sure, we do fund and have access to a full continuum of services, but we do require folks to go outside of St. Clair County for some of those. So if you want or need residential care, our nearest provider is just outside of St. Clair County. Sacred Heart is, technically in Macomb County. Or we send people to Oakland County or Genesee County, and sometimes further depending on availability of beds. The same is true for detox services and for opioid treatment programs. And a A licensed opioid treatment program, or OTP, provides methadone. So if you need other types of medication assisted treatment, that we can access in St. Clair County. But if you have someone who really needs for a time being to be on methadone, they need to go out of the county at this point to get it. And it's important to know that when you start dosing someone on methadone, it's daily dosing. So you're talking about the impact of making someone get to a place in another county every day, and a person who oftentimes may not be driving themselves. There are some real hardships in terms of access to care. One of the other things I want to touch on is, we've talked a lot about substance use disorder services for kids, and we don't get referrals for kids. Over the course of time, 1% or less than 1% of our referrals across the region are for people under 18. And in fiscal year 22, which is the last full year, we have data for that, we received a request for treatment and authorized one child in St. Clair County for the full year. There's a couple of theories that kind of would point to why that happens. One, a lot of kids, if they are with their parents and their parents have private insurance, they may be accessing that care through that private insurance as opposed to going through the public system. The other thing is that when a kid has alcohol or drugs, it's against the law. And so what we really see is a lot of those kids enter the system through the legal gate. And they end up, when we used to have a juvenile detention center and with the Day Juvenile Night Watch program, you'd see a lot of those kids in those programs that were actively using substances or had issues, but they haven't over the course of time tended to get to us. And like I said, we only answer the phone, we don't make it ring. So it's just a matter of, not that there's a whole bunch of services available. I mean, there are outpatient services available, but even those are very much less available than for adults. But part of it has been demand. And that's region-wide, it's the same thing. It's less than 1% of the people that we get calls for are under or authorized or under 18, and about 1% are over 64. The 25 to 39 age group is primarily, that's our biggest age group in terms of referrals.
Well, you mentioned the legal system, so that's a good segue over to Matt. Do you have anything to add, Matt?
Yeah, so as far as our interaction with youth, our goal is to get to the young people before they start using and get those interactions and outlets to them so they don't turn to drugs and alcohol use. They see there's another way, because oftentimes, almost always, I won't say always, but pretty close, kids that dabble with drugs and alcohol are seeing it at home. So our community events that we have for outreach for young people and our school resource officers are so key and instrumental in interrupting the flow of drugs to our children. See professionals, see police as normal people on a day-to-day basis is very important. And we also have that connection with our deputies and other law enforcement out on the street to contact those SROs, school resource officers, if they had contact with a household and the student's going to be going to school, and letting the SROs know, hey, so-and-so had an incident at their house last night, maybe a domestic or some kind of event that we need the school resource officers to know and the school to know, so we can wrap around these kids and support them, so lessens the likelihood of them turning towards drugs and alcohol. Other things in our road patrol is, we talked about it, naloxone or Narcan. We carry that, and it's pretty often that our deputies are arriving on scene before tri-hospital or fire, just because we're always out and about and administering Narcan. So that's pretty robust. Frankly, we started carrying it more regularly because of the threat of our people getting exposed to opioids, and then we realized, hey, we are oftentimes showing up quicker because of our mobility. So we've trained everybody, and everybody carries it in the sheriff's office. And then, of course, our services in the jail. We have a lot of services in the jail with our medical assisted treatment program, where we partner with Sacred Heart. We combine certain medications with therapy to set people up better to recover from addiction. We have AA and NA programs and mental health programs in the jail. So if people are addicted or they're struggling with their addiction, when they're in our jail, we can continue or start up those services. We always say we have a captive audience, right? And when we're talking about somebody who's struggling with addiction and they want to get better, and you know, we're all rooting for them. Sometimes if they're outside in the outside world, something can interrupt that those services because of the environment or whatever. But when they're in the jail, you know, they're going to be sober if they like it or not. So we can get them to services. And a lot of those services also include our faith-based programs. So we offer all these services, and the idea is, especially through our faith-based programs, they tag along when they're released, right? So they're not just released and let go. When they're released, they are offered an naloxone kit to take with them when they leave the jail, so they have that if, God forbid, they relapse or they know somebody who is struggling with that type of addiction. So those are, in a nutshell, what we serve.
Well, we do have a lot of services, and I know in a minute we're going to talk about the gaps that we still see, and we've actually talked about some of that already. One thing I don't think any of us mentioned Recovery Corp, but we do have that in our community, and CMH is a partner with that. And I think we've talked about all the other things, but people can always go to our website to see all the substance use services we provide. And I'm sure the websites of anybody else online here to see what we have available in the community. So we are, let's see, we have about 17 minutes to go and 2 questions. We may or may not get to our last one, but the next question is, what ways do you see the residents in St. Clair County actively supporting and assisting individuals living with substance use disorder or in the recovery process? And I will start with Jim this time.
Okay, so we're a funder, and so we don't have our lane is really the formal treatment and prevention, lane for treatment. So, but we do recognize and notice the impact of people in recovery on providing avenues for other folks to recover. And we are very aware of the presence of AA and NA, Families Against Narcotics, grassroots recovery community organizations like B-Rock, and we also have Serenity House over here in Genesee County, places like the Dry Dock, and our spiritual organizations. And we recognize the critical importance of several pathways to recovery, because not everybody's path is going to be the same, and not everybody's path is going to lead to our services. We're limited to funding those formal treatment and prevention supports, but certainly recognize the importance of communities providing other pathways.
Good. I saw somebody in the chat asked if we still had Hope Not Handcuffs, and I don't think you just said that one, but we do have that also still in our community. But maybe you want to talk a little bit about that, Matt?
Yeah, thanks. I saw the chat. Yes, we still do have Hope Not Handcuffs, and that's where people can come to the sheriff's office, and there's some other police agencies that participate, where they just walk in and say, hey, listen, I need to get to a recovery place. I need to get some help, and I need it now. And they don't have to worry about, us trying to find a reason to bring charges on them and take them to jail. We provide a place, and a phone number is called by our corrections staff. An angel is notified, and they'll come right to our sheriff's office and take that person as quickly as they can to a recovery place. So we do still have that. Some of the things that I see the public being involved in as far as recovery and supporting recovery, again, we've talked about Narcan, the destigmatization, if I can say that word, of
It's a mouthful.
Yeah, and participating in that is a huge step, because not only every time that is administered, there's one more chance to get some help and get into recovery, but it also shows people, hey, we're all here for you. We don't want to slam the door on your face because you're dealing with a problem with addiction. So it's a big support thing, and obviously what the Narcan actually does. The services in St. Clair County, there's a lot of nonprofit services, and I go to a lot of these events, and they're well supported. There's people at these events, and you'll see somebody from maybe the B-Rock event go to the whatever the other event is, and maybe the only correlation is the fact that they want to support services in the county that need support, and that outcry of financial and voiced support carries a lot of weight, because if individuals in our society are dealing with addiction and they don't feel like anybody wants to deal with them, they don't feel like they're supported, they're much less likely to go get those services. So
Right.
those are some of the things that I see. Also, I always, in these, the yearly webinar we're having right now, I always bring up the fact that law enforcement has a great responsibility to be part of the solution to recovery. And we are partners with so many people on the screen, but I always have to bring out that we are the only arm that can and do enforce the law. And there are people who end up being victims because of crimes related to drug use and alcohol use. So we have to still man that table, if you will. We're the only ones that can do it. So we can't pull away from the fact that our job is to enforce the law. And that is something else I see the public that participates in. You know, we have a drug task force that's very embedded in our county and does a lot of work. Not, you know, it always spills out into other crimes. And we're very well supported by the public who say, hey, listen, we got a drug house over here. And our job is to, at that point, do an investigation and shut that drug house down. But without that information from the public, that job would be much harder. So that's another part of law enforcement's job in the recovery world, is to interact with enforcing laws, and the public really does support us in that.
And your task force have done tons of great things in shutting down drug houses and confiscating large amounts of drugs and things like that. And so we appreciate all those efforts for sure. Okay, Liz.
Sure.
Whenever.
Yeah. So public, I think in our lane here at the health department, we see a lot of public engagement in our, when we convene groups, right? So our community improvement plan, we ask all the time for community member input. You don't have to be part of one of these organizations to tell us what's going on in the community and what you'd like to see. So we like to put that out there. We also have community advisory committees at all of our child and adolescent health centers. So that would be our main office at Port Huron High. We're opening a new one in Algonac and Yale soon. Those groups, we ask for parent and student input all the time on these type of topics. We get a really poor turnout, which is sad. I think we need to do better. Because there are community members who want to be involved. I don't think they know about the involvement. And I think we're working hard at doing things like not having in-person meetings, but doing a Zoom that makes it more convenient for a student or a parent to offer their opinions. The other thing, as far as public that we see, we talked a little bit about those who kind of speak against our harm reduction program, but there really is a lot more individuals who support it, who speak out in the community and advocate for us. I would agree with everybody else that we have a wonderfully supportive community who do wrap their arms around people when they need help. It's just identifying who needs that help. And I think we're a very helpful, loving community here. And one really practical story I wanted to share and shift we're seeing here in harm reduction is individuals who are on that continuum of recovery are coming in here, and we call it a secondary exchange. So they're not actively using anymore, but they're still embedded in those communities. They're getting these supplies here and bringing them out and doing almost like street outreach for us. They are bringing and getting into communities where we don't know where the people who are using are, and they're doing that work for us. And it makes them feel good. They feel like they have a purpose. They're kind of giving back. And that's really been a really large shift. They actually take supplies out in large quantities to the communities and have really been the touch point. We think that's why a lot of people aren't coming in here to our building, because we have key people taking everything out there in the streets, and that's something we can't do. So the public is actually responding and doing some of our work for us, which is awesome.
That's great, and that is great for the people that are in recovery, and then helping give back, and also get into the communities where people need the supplies that you are offering. So that's great to hear. Did I ask everybody to respond? Ken, did you respond to this question? Go ahead.
No, and it's those ways that how can the community support recovery efforts, and one of the two of the big ones are compassion and patience. That these individuals who are still using, the individuals who are in recovery, who are figuring out recovery, these are your neighbors. These are your former classmates. These are the parents of your children's classmates. These are people who are around you that are working and doing what they can. It is that recognition that we are around you, that we are people that hold jobs in recovery. And I say that we as a person in long-term recovery. I'm privileged enough to be able to sit at work groups and panels like this. When I came here in 2009 after leaving Sacred Heart, I probably was more likely to run into Sheriff King outside of a meeting. So recognizing that people can move through the challenges they may have had previously to move into more whole lives. I am a person who would have utilized the syringe service program 15, 20 years ago if they were around. So knowing that people like myself, we're in your community. You don't necessarily know we are in recovery. It is not always this known spot. So that recognition that we are here, and we just appreciate any of that continued support, the patience, the compassion, the treating others with a substance use disorder or an early recovery as people, because that's what we are.
Well, I would just like to take a quick minute to congratulate you on your continued recovery, and how happy we are to have you on the other side of that, because you have been a leader in the recovery community in terms of leading the treatment prevention recovery work group, looking at services in our community, ways to improve things. And so having you on this side of things has been really beneficial to the community. So thank you, and congrats again on your long-term recovery.
Thank you.
You're welcome. Jim, did you have something you wanted to add?
Yeah, just in terms of things in the community, we're actually sponsoring, I'm sure most of the folks on this call, or many on this call, know Ken Briggs from Meridian CPI, one of our providers. Ken and some of his group are bringing, we're sponsoring and bringing in a film to Port Huron called We Can Be Heroes, which is a documentary film about a Detroit boxer named Taylor Dewar who had struggled with addiction and is in recovery. So the filmmaker and Taylor will be there. We'll have a panel discussion for the community after or between screenings of the movie. I believe it's going to be at McMorran. We'll get flyers out. The home would actually switch back and forth venues a couple of times. But it's an important community event. We're inviting people in recovery and other people in the community. And I think there's going to be a separate session for you, and then kind of talk about recovery and pathways, and to hear this. It's a story. It shows no matter how successful you are, you can still be prone to addiction. I mean, this is a successful professional boxer. Finally, two athletes and went down that path. So anyway, that'll be November 8th, and look for flyers on that, because we will want community presence, and again, there'll be a panel discussion.
Yeah, I think that's going to be a great presentation. And Ken Briggs, along with some other folks that he works with, have been doing a lot of work to try to continually address the stigma issue. We had Braylon Edwards at our Run for Recovery last spring, talking about his journey to recovery, and how everybody needs somebody sometime to people need support, and that's what communities are for. That's what people are for, and I think the recovery community has continually stepped up in that arena. It looks like we are almost out of time, so it's time. I don't even think we have time for questions, so we're going to wrap it up. And I want to thank all of our panelists today for sharing your time and valuable insights into the services and supports that we offer in this community. Addressing the substance use crisis it is a collaborative. I was going to say it's undoubtedly a collaborative effort. It needs to be collaborative continuously. We've got to continually work together to address this. And we're privileged in our community. We work really well together. We have the community service coordinating body. All of you are members to that, and we do a lot of collaborative things. When we were talking about recovery community events before, like the big recovery softball event, that brings out a lot of community organizations and just continually raises awareness about the issue. So again, we thank you all. Thank you, Matt, Jim, Ken, Liz, for all of your contributions today. And to our attendees, we appreciate the support, your support in our efforts, and are encouraged by your interest. I saw a lot of good comments coming through about how happy you have been to be able to attend the series. And so we're happy that we were able to bring a lot of good information to you, share a lot of great recovery stories. I know that I always find those to be the most inspirational, and it gives us kind of time to take pause and know that there's a lot of meaning in what we do. So thank you all. And this is the conclusion, of the 2023 Recovery Summit. So thank you all and have a great day.